Good evening. Good evening. Good evening, beautiful people, and Happy New Year. And yes, it is the end of the month of January, and I'm still saying Happy New Year to everyone. We are so glad you've taking time out of your busy schedules to tune into this month's edition of the Ask Mary and Pat Show featuring Miss Mary Finner and Miss Pat Boga. Unfortunately, Miss Pat Boga is not available tonight, so Miss Finner will have a few guests with her tonight. And before I move forward, I would like to introduce myself. My name is Thomas Robertson, but everyone calls me Duke. Hopefully, by now, you should have that printed in your brain. I am the Technology and Metrics Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. In addition to this Zoomcast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. So feel free to like and share on your social media pages. Also, feel free to post any questions or comments in the Zoom chat or in the social media comments. We will do our best to respond to each question on tonight, and if not, we will do our best to reach back out to you at a later date in time. Few announcements. Our next Ask Mary and Pat show will be February 27th at 6 p.m. So go ahead and put that in your calendars for February 27th at 6 p.m. And now I will turn it over to Ms. Mary Finner. Ms. Mary Finner is in your hands.
Good evening, everyone. I would like to welcome you to Ask Mary and Pat. As Duke had said earlier, Pat is not with us tonight, but we have Brenda Wilson that's going to be a stand-in for her tonight. And we have questions that I'm a Medicaid assister with Oak Hill Community Center, and we have questions that we're answering questions today regarding anything dealing with Medicaid or health insurance or any type of questions you may have regarding with that. Okay, Brenda, you can introduce yourself.
Yes, I'm Brenda Wilson, certified federal healthcare navigator in the area of Region 8, and I'm located physically in Columbus, Mississippi, the Golden Triangle area. And as we go through the questions, there may be some input from my end for people who may need additional health care coverage if they should lose their Medicaid.
Okay. So the first question we have is dealing with the Medicaid unwind. And as everybody know, we're in the midst of, or getting towards the end of the public health emergency. And that's something that was established by the Biden administration during the pandemic to help with medical concerns. And our first question is, what is Medicaid unwinding? Okay, Medicaid unwinding is when the public health emergency ends, Medicaid will return to normal eligibility. That means before doing the public health emergency, there were no Medicaid. Medicaid was not terminated for people, regardless of their age or any type of income changes in their household. They were allowed to keep the Medicaid. But now, since we're getting toward the end of the public health emergency, they're calling it Medicaid unwinding. And now we're about to return to, Medicaid is about to return to normal eligibility. Okay.
Okay. And question 2 says, will people lose their Medicaid when it returns to normal eligibility? It is estimated that between 5 to 14 million persons are likely to lose their Medicaid nationwide. And that is because, as she stated earlier, people were allowed to stay on the Medicaid program regardless of changes in their household because we were under a public health emergency. Now, the public health emergency may continue within itself, but the Medicaid unwinding portion was a mandate that was put in that no one should be put off the program because of the public health emergency. However, if persons are going to be faced with redetermination, and we'll talk about that later, they may lose their Medicaid initially, but we'll address some of those in these other questions.
Okay. When will the unwinding process begin? Well, actually, the unwinding process begins April 1st. And each Medicaid office in the state of Mississippi has a year to complete the unwinding process. So it's a possibility you may keep your Medicaid. It's a possibility that you may come off Medicaid. It depends on what it is that you have going on at that time.
Right. Our next question say, how will it be done? How will this process take place? Well, according to the information we received in our CMS webinar, everyone on Medicaid should be receiving a renewal notice or some type of letter. If possible, if there's no changes and there have been some recent updates, and I'm not sure the time frame within the Medicaid office itself, some offices go on a 30-day revolving time, some go on 45 days. But if you have a renewal, they should be sending you some type of letter. And if you have not had any changes and this has been established already, then you'll be automatically renewed. Now, they may need some additional information, and that's one of the reasons why we're hosting this, is because we want to caution everyone about checking to make sure your information is up to date.
Okay, another question we have, if I have moved, do I need to contact the office with updated information? And yes, please let them know of your updated information. How that's the way that they can contact you to find out if your renewal, how will your renewal be completed. So please let them know. If they send you a letter and the letter comes back undeliverable, you will automatically be cut off of Medicaid. So if you have moved within the past year or your phone number has changed, because they may, if they get a letter stating undeliverable, they may try to call you to, get an updated information over the phone. So please let them know if you have moved. Contact your local Medicaid office and submit your new address and phone number to your local office.
Okay. And the next question says, what can I do if I am no longer eligible for Medicaid? We have, which is one of the things that I do as a federal certified navigator, we have a program through Affordable Health Care, and you can apply for the Affordable Health Care program through the healthcare.gov, or you can contact a navigator. Oak Hill Regional Community Development Corporation has a website. On that website, if you go to Get Covered Mississippi, you will find a list or a link that you can click on, and it will take you to assisters and navigators. And you can click on an area on the map to find the ones in your area. And this information is available 24/7. Now, we will explain to the consumer if you are no longer eligible. We will go through a series of questions with you. All of our services that we provide, first of all, is free. We'll be there to assist you and answer questions regarding the types of medical programs that's available to you. We'll be there to help you navigate to see if your provider is in the network, if your medicine is covered in that network. Most of all, we'll be there to assist you along the pathway of identifying reasonable, affordable healthcare options.
Okay, the next question we have, what can I do? What if I'm not eligible for the ACA? What can I do? Well, what you can do about that, if you're not eligible for the Affordable Care Act, we will refer you to one of our federally qualified health centers for medical assistance, and you can contact them and check and see if they can assist you. And we'll refer you to them. And there's a number of them across the state of Mississippi that you can go to.
Right. And that information also, because the next question says, is there a fee for the federally qualified health center? The fees are based on a sliding scale, depending on your income. And one thing on that Get Covered site, there's also a place you can go to get a listing of the federally qualified health centers closest to you. And these centers provide full medical coverage for various things. Each center has its own unique service. Some are more expansive than others. I know in my area, we have one in the Meridian area. They cover dental as well as an array of different options for coverage. So we would encourage you to try one of the federally qualified health centers, and you can call ahead of time and ask them about some of the things that they offer. And when you go there, they will have the scales there. They will explain all that to you when you get there.
Okay. Our next question, people want to know, what is a renewal? Where Medicaid renewal is the terminology or wording that Medicaid uses to see if you are still eligible for Medicaid. And the next one, how can I tell when it's time to renew? What you're going to do, usually after a year after you have been on Medicaid, after you have gotten approved for Medicaid, you are required to do a renewal once a year. If there's no changes, usually you'll be renewed and you'll get approved again. But if there's a change in income, depending on what it is, if a parent is on and their income has changed, they may no longer be eligible for Medicaid, but the children probably still will be. So renewal is what Medicaid uses to determine if you are still eligible for Medicaid.
Okay. And it says, what number do I call to apply for Medicaid? You can contact the Oak Hill office. That number is 662-298-3584. Again, if you want to contact the Oak Hill office, our assistants are available to help you. That number again is 662-298-3584, or you can contact your local Medicaid office.
Also, there is no fee when you contact our office for assistance. We do not charge for any type of assistance. If you apply for, you can apply for ACA. You can, if you need assistance with applying for Medicaid, we can help with that. And there's no fee that we charge for assistance. So our next questions, when should I start looking for my renewal notice? Usually a renewal notice is given out 3 months prior to when the renewal is due. So it's so you have, they'll give you the renewal 3 months prior to whenever you were approved the year prior. So it's usually 3 months prior. You'll get the notice in the mail.
And isn't it true though, Ms. Fenner, that if a person applied and was approved, say for instance, in the month of January, then that renewal, well, it wouldn't be right now, but let's say when the unwinding process start, it would usually be 3 months to the month in which you were actually approved?
Right, it's 3 months prior to the month you actually approved, but it would still start on the month that you were approved. You'll just get the notice 3 months
Right.
prior to, but with the unwinding, it's an entirely different situation. It's not the same as normal, as they would proceed normally with regular Medicaid renewals. So it's something entirely different with the unwinding. Everyone is going to get a renewal notice during the unwinding, regardless. And if they can renew you without getting any additional information during the unwinding, they would automatically renew you. But if they need additional information from you, then they will contact you and you will have so many days to get it back to them. But it still takes up to a year. Once the unwinding starts, which is April the 1st, they have 12 months to process those renewals.
But the person, as long as they have not had to go to complete that, they will still be under the Medicaid coverage, right?
Right. You will still be under Medicaid until you receive a notice stating that you're no longer eligible. But if you haven't received a notice, then you're still eligible for Medicaid.
Good. It says, do I have to pay out of pocket for services? Normally, you do not have to pay for services, but there may be a $3 to $5 copay if your child is on the CHIP program. Also, there may be medication that is not covered by Medicaid. And these are some things that you should be able to look at your provider if certain medications are covered. They usually will give you a listing of like tier 1, tier 2, tier 3, and your pharmacist should be able to tell you which one of these items are covered as well.
Right. Okay. Once I apply for Medicaid, how soon will I hear if I qualify? Well, it takes about 30 days. Normally, it takes 30 days for them to process your application. This is normally. But if they need additional information from you, they will contact you within 2 weeks to request that additional information from you. But right now, we're going to take a break. I think Duke has a commercial for us.
Okay.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
Okay. So our next question is, someone wants to know if they're 30 years old and have a job, will they be eligible to apply for Medicaid? If you're 30 years old and work, more than likely you're not eligible for Medicaid unless you're pregnant or you're disabled. If you happen to be unemployed, you are eligible. It's based on your income. Also, you have to have a child in the household under the age of 18 in order to be eligible for Medicaid. So if you have a job, more than likely you're not eligible for Medicaid, but you can apply for the ACA and you may be eligible for a special enrollment period.
Right. And that next question asks that, can my 19-year-old Medicaid be terminated before March 31st since the public health emergency is ending? No, no one's Medicaid is supposed to be ended or terminated before April 1st. The first terminations began April 1st. So you should be safe at least until April 1. And I think there may be some other things. Ms. Fenner, is there some other qualifications that may be there for a person who's 19 and eligible for Medicaid, like their health conditions or things of that nature?
Well, as far as Medicaid go, even though if you have any type of health problems or issues, you're still not eligible for Medicaid. Once you reach 19, there's no program in the state of Mississippi for the age group 19 to 64, not unless you're disabled. But if you have children and you're 19 and you're unemployed, you may be eligible for Medicaid as long as your children are under a certain age, and it also depends on your income. So there's a possibility, if you're not disabled, you also will have to cooperate with child support if you have children under the age of 19, right? So that's another important factor with Medicaid for that 19-year-old age group.
Right. And also, what about the mother, the pregnant mother, who she was on there and she's already went through her year of coverage? What will happen with them? Okay,
pregnant individuals that went through their year coverage, they will more than likely come off if they're employed, if their income is over the income limit. But if their income is not over the income limit and they agree to cooperate with child support, they can still receive Medicaid. But there also is another program called family planning, which deals with issues, or not issues, with through the health department, that you can get services through the health department for different things dealing with family planning. Usually when a person, after they had their baby and they're no longer eligible for regular Medicaid, they're automatically put on the family planning services.
Okay. All right. You want the next question?
Okay. If I receive a renewal form after the PHE, and I think we already talked about that one. So what are my options for health insurance after my child's Medicaid is closed? You have a couple of options. One is to apply for the ACA program through a special enrollment period. And if you were denied Medicaid, you are eligible to apply for the Affordable Care Act through a special enrollment period. I think they sort of extended the special enrollment period because of this. And also we have the federal qualified health centers that you can go to if you're no longer eligible for Medicaid. And as Brenda was talking earlier, you can contact them because certain centers cover certain things. Mostly all of them cover medical, but some of them may have where you can get services with an optician for your eyes or dental services. So you can contact them to find out what they, especially that they have, so you can meet your needs.
Right. The next one, it says, who can I get help? Who can I get to help me with finding a plan through ACA and get enrolled? As we stated earlier, we have an array of navigators available in the state of Mississippi through Oak Hill Regional Community Development Corporation. That number we cannot emphasize enough is 662-298-3584, 662-298-3584. You can go to the Get Covered Mississippi website. It will give you an opportunity to click on a link to find out a navigator in your area. And keep in mind, our services are all free. We work with you. We can work with you virtually. As long as we get certain documents completed, like consent forms, because we have to have your consent in order to complete a process of assisting you. And in doing this and in saying this, as a healthcare navigator, we can preview based on your information you provide, depending on your income and your household occupancy. That's the number of people in your household, as well as the anticipated annual income. We can do a pre-screening using what we call the window shopping tool. With that tool, we're able to go in, input your data without your name, without any personal identifying information. That's a good thing because you don't have to give us social security numbers or anything. We'll just simply put in the person's age, the age of the dependents. We'll put in your annual anticipated income. We'll put in your age of your dependents. And then with that, the system will automatically generate what we call an advanced premium tax credit. Now, you will have to file taxes for the year in which you're covered. So if you're losing your Medicaid in 2023 and you want to use ACA coverage, you will have to say that you're going to file taxes because that's what you get the premium tax credit for, to offset the amount of your premium. So with that said, what we'll do once we input that information, that basic information, it will pull up the different types of plans as they will identify you being eligible for. We don't have, as navigators, we don't pick out the plans. The system automatically generates a list of healthcare plans. And these plans can have, depending on what we call the metal coverage, the bronze, the silver level plans, or the gold plan or the platinum plan, they all offer a certain percentage of discount for, I said discount, a percentage of coverage for your particular plan. The good thing about going into the affordable health care plan is that even if you have a deductible, or let's say you have other cost sharing, all the essential benefits are covered, which means that you don't have to meet a deductible to have certain health care coverage completed, such as your annual checkups for like your mammogram for ladies, certain screenings you won't have to pay for, or you don't have to worry about meeting a deductible. So giving us an opportunity to work with you, everything is upfront. We can look up your network providers. We can look up your prescription drug plan. There's so many things that we can do to help you. In addition to that, let's say we get through all of that, and let's say a person is not shown to be eligible. You always have those federal health quality health centers available to you. So just don't give up. We want to encourage everybody to get covered in Mississippi. And we're here to assist you whichever way we can. And then sometimes there are community resources out there in your particular area that we may be privileged to, that we can share with an individual. Just don't hesitate to call us and give us an opportunity to assist you with your healthcare needs.
Yes, that's what, as Brenda was saying, if you need any type of assistance with your healthcare needs, please contact us, because we're trying to assist the people of Mississippi to get better health care services. And if there's not an ACA program that's available for you, or you're not eligible for the ACA because maybe the premium is too high, we'll still try to assist you with getting quality health services to meet your medical needs. Now, I know some people may think, well, I don't want to go to a federally qualified health center because they may think that is not a regular doctor's office, but they have doctors there that can assist you. And it's not just a clinic, as some people may think, well, that's a clinic. No, it's not a clinic. It is actually a doctor's office, and they have doctors there that can assist you and help you to further your medical needs. So that's one of the options, because some people may not be eligible for Medicaid once this unwinding starts. Some people may not be eligible to get an affordable services through the Affordable Care Act, right? Affordable Health Care Plan through the Affordable Care Act. But there's always the federally qualified health centers, and some people have insurance and still go to the federally health care centers, because they have good services there. So those are some options for you. And right now we don't have any more questions. Are there any questions in the chat or on Facebook?
While we check, we'll just go to commercial.
Okay.
Congratulations! You have successfully selected and enrolled in a marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
Okay, Duke, were there any other questions in the on the Facebook?
No, ma'am, I didn't see any more questions.
Okay, then.
We just hope the audience will keep in mind that we are here to assist you. We do it in a very fair and impartial manner. We try to be as friendly to you as possible to let you know you're dealing with someone who understands your need for healthcare coverage. And we just don't want anyone to be left uncovered. If you have families and friends that you know of that may not have access to even this recording, that they will contact us. You can share our information with them so they will know how to go about getting help with their healthcare coverage.
Okay, that was real good, Brenda, because that's what we are here for. We are very concerned about the healthcare coverage, and we're here to assist you in whatever way we possibly can.
Mm-hmm. Even if you're not sure, just ask questions. You know, there's no question that's not too important to ask, no matter how simple you may think it is, and no matter how intense you may think it is. We're here not to criticize, not to scrutinize. We're here to help. Do you want to go over those renewal steps again with the consumers about things they need to make sure that they know that they need to do while they're still covered, so far as providing their information?
Okay, what they're going to send out to you during the unwinding, they're going to send everyone a renewal notice or a letter. A notice is to let you know that we still need more information from you in order to get renewed. A letter will let you know that we have renewed you based on the previous information that we have from you. So there's a possibility that people will still be renewed automatically if they have the information that they need. So it's most important that you give them your change of addresses and your current phone numbers if you have moved or if anything has changed. So please open up your information from the Medicaid office. That notice or that letter will be very important to you to let you know what your next step is.
And if you know of someone in your family that needs health care coverage, they can apply for Medicaid even if they're not sure of their eligibility, because you just never know. And there's a list of things that is printed online that you should apply or you're encouraged to apply. Number one, if you're pregnant or think you may be pregnant. Number two, if you have a child or teenager under 18 or under, if your child is in foster care or has been adopted. Even says that if you've been diagnosed with breast or cervical cancer, if you're blind, if you have a disability or disabilities, if you need nursing home care, if you're over the age 65 and you have very low or no income, although we may assist with the children, the dependents, just keep in mind that there may be other opportunities for persons who are not necessarily 18 and under, but there are other opportunities too to apply for Medicaid.
Okay, that is all that we have for you tonight.
Great job, ladies. You guys did such an amazing job on tonight. And thank you, Miss Brenda Wilson, for coming along tonight and doing an amazing job.
We do have one more question in the chat that just popped up.
All right.
And it said, does an individual have to report income changes for renewal, or does the Office of Medicaid automatically pull your income? You are supposed to report income changes to the Medicaid office. In Mississippi, if once a child gets approved for Medicaid, they automatically stay on Medicaid regardless of income changes for 12 months, for a year. They cannot be terminated within a year. And that's in the state of Mississippi. Some other states do different things, but you still need to report income changes. If an adult is on Medicaid and their income change, and they have an income change, it may take them off of Medicaid, but the child will still be eligible. So yes, you need to report all income changes.
And that goes also for the age of the children too, right? Or will that automatically be a given, since if a child they know it's going to be 19?
If
Would
a
that
child
be a
is
given, or would they have to?
they have to report it, even though they should get some information stating that your child is no longer eligible after a certain date. They usually send out that type of letter. So,
And I guess what we're trying to encourage the consumers to do not throw away any mail. If you get some mail and it has that Mississippi Medicaid address on it, please open your mail and check it out. Please open your mail. Do not discard your mail.
Right. Do not lay it to the side and say, oh, this from Medicaid. Please open your mail and see what the letter says.
Another thing, Ms. Fenner, would you say that normally they will not get a call from the Medicaid office, that no one should be calling you about your Medicaid? Because you have a lot of scammers out there trying to get people's personal information.
Right. There are.
Are you aware of anything like that?
They will call you though, but it will be from, you should recognize the number. It should be from the Medicaid office. But they will call you, but they shouldn't ask you for any type of personal information. They will call you and ask you, they won't ask you for no Social Security numbers and things like that, but they may call and ask you to send a check stub in, or they may call and ask you, has your address changed? But as far as them asking for Social Security numbers, personal identification information, they shouldn't ask that over the phone.
So that's a red flag if somebody tries to get that information.
Right.
From you.
That's true.
Okay. All righty then.
Well, once again, we're thankful for all those good questions, and they were such amazing questions. Ms. Fenner, that's a great way to start the year off, right?
Yes.
So if you ever have any questions, please get in contact with us at 662-298-3584. And ladies, could you guys give your extensions in case anyone would like to speak to you directly?
Okay, I'm at 662-298-3584, extension 107.
And I'm also X the same, and my extension is 106.
All right, thank you for that, and thank you for everyone who tuned on Zoom as well as on our social media pages. You may learn more about us at www.oakhillregionalcdc.com and www.healthykidsms.org. You may contact our office, and that number is 662-298-3584, or you can text us at 662-689-9712. Once again, we acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. This has been a production of Oak Hill Regional Community Development Corporation belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Thanks for tuning in. You all have a blessed and safe night.
Good night.